Hi, I'm Dr. Brian Koffman, a retired family doctor and a CLL patient myself, and I'm the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. And I'm going to share with you some important research that's presented either at some major hematology conferences or in major peer-reviewed journals. And today I'm going to discuss an article that I'm very proud of, which I've titled, "A Charter for Improving Care for Those Living with CLL." What's the bottom line about this? People living with CLL deserve an accurate diagnosis, holistic care, and a voice in their decisions, shared decision making. This charter that I'm going to discuss reflects input from patients, advocates, and experts from around the world. Who performed this research and where it was presented? I'm proud to say, and humbled to say, that I was the lead investigator for a group of international CLL researchers and clinicians, patients, and advocates in the publication of A Charter for Improving Care for People Living with Chronic Lymphocytic Leukemia, 6 Principles for Excellence, in the peer-reviewed journal Leukemia and Lymphoma. Let's go into the background a little bit. As most of you know, chronic lymphocytic leukemia, or CLL, is the most common blood cancer in the Western world. Although there are guidelines that are available for how to manage it and how to treat it, they generally pay scant attention to the holistic needs of those living with CLL for what is usually a very long and complicated journey. This charter defines the care standards for all patients living with CLL. It outlines what they deserve. Its principles reflect a global ambition to improve care and quality of life for those affected by CLL. It acknowledges the disparities between high-income countries and low- and middle-income countries, recognizing how these differences may shape local care models and the feasibility of implementing some of the policy recommendations. What was the method that we used? A series of global roundtables brought together healthcare providers and professionals, patient advocates, and people living with CLL to identify unmet needs and to develop care principles. And this was truly a global, multi-continental group that was pulled together. Their recommendations were refined through literature review and further input from participants to create this charter. What were the results? Well, I'm going to share the 6 principles, but I want to tell you up front that the percentages that I'm going to be presenting come from the 2024 Global Patient Survey on Lymphoma and CLL. What's number 1? Everybody deserves an accurate diagnosis. Accurate diagnosis is fundamental and foundational for effective CLL care. Yet, a full 1/3 of patients report receiving an incorrect initial diagnosis, and 34% were never told what their CLL subtype was at the time of diagnosis, which is fundamental for choosing the right therapy. A complete workup that includes a complete blood count, or CBC, and flow cytometry is essential, with molecular and genomic testing highly recommended in high-income countries. However, many patients do not receive these tests as recommended, and low and middle-income countries, limited infrastructure, and financial constraints cause delays or misdiagnosis. Up to 3/4 of low-income countries lack readily available pathology services. These gaps contribute to poor outcomes. International investment and collaboration are urgently needed to improve diagnostic capacity. Number 2, high-quality information. Patients must receive tailored, accurate, and accessible information to make informed decisions. Yet, almost 1/2 of patients said diagnostic results were never explained in a way that they could understand. And 41% lacked sufficient information about their disease and treatment options. Information should be personalized. It should be culturally appropriate and delivered in multiple formats that meets the patient where they're at. Most patients prefer direct conversations with trusted healthcare professionals, but many lack such opportunities. Addressing this gap requires dedicated time and training in patient-centered communication. I'm going to pause there for a second because I have an ant crawling on me.
Okay.
I hope I gave you enough of a pause that you can continue.
You get a little pause going in too. And you're
All right, so I'll go 3. Shared decision making. Shared decision making helps ensure care aligns with patients' preferences. But a full 48% of patients felt that they were not involved as much as they wished in their decisions. Additionally, 61% said they lacked enough time to consider treatment options, and 70% were not offered more than one choice, a full 70%. Implementing shared decision-making requires time. It demands improved health literacy and support tools, particularly in low and middle income countries, where structural and cultural barriers may exist. Solutions might include the use of simple decision aids and provider training to support these collaborative conversations. Number 4, access to care and specialists. CLL requires lifelong coordinated care. However, 1 out of 5 patients said they were not treated by a cancer care team or coordinator. As treatment options expand, access remains uneven. 41% of patients face barriers to receiving their most recent therapy. Clinical trials are a key opportunity, but only 48% of patients were informed about them by their healthcare providers, despite the fact that 77% recognized that trials could offer better treatment. Healthcare systems must ensure patients have access to specialists, new therapies, and to clinical trials. Number 5, emotional and psychological support. The chronic and uncertain nature of CLL places a heavy and lasting emotional burden on patients. Yet 62% said that their mental health needs were either not addressed or neglected in their country. A full quarter said that the doctor didn't ask them about the quality of their life. 55% received no follow-up about their concerns, and only 38% felt their doctor understood how the CLL affected their life. Only 38%. Sad. Mental health screening and support services must be integrated early and throughout the whole healthcare journey. Finally, number 6, holistic model of care. CLL increases the risks of complications such as infections, fatigue, autoimmune issues, and cardiovascular disease. Among patients reporting fatigue, 46% said their doctor had not offered support or information within the last 2 years. Between 1/3 and 1/2 of all CLL-related deaths are infection-related. Care must extend beyond the disease itself to address the broader impact of having an impaired immune system from CLL. A shift towards holistic, multidisciplinary, chronic care and survivorship is essential. So what have we learned? This article presents 6 core principles developed by the global CLL advocacy community. They outline what every person with CLL deserves and should expect from their care, regardless of their geography. While disparities exist, listening to the voices of people living with CLL and addressing their needs through equitable, patient-centered care remains a universal priority. On the website, we give a link to the article which is freely available titled, "A Charter for Improving Care for People Living with Chronic Lymphocytic Leukemia, 6 Principles for Excellence."